Among the Kalabari people in southeastern Nigeria, West Africa, abundant body fat is the beauty ideal for women. Before their wedding, women of this tribe are sent to fattening resorts where they gorge themselves on food, move as little as possible, and even take drugs to increase appetite and promote weight gain so that they can fatten up to be admired by everyone and become more desirable in the eyes of their future husband. Our concept of what is normal and what is abnormal, what is acceptable and what is unacceptable, is first and foremost a result of our environment, our culture, our values, what we see around us, and what our parents taught us. And this applies to body weight as well. Unfortunately, in our countries, our current notions of ideal body shape and weight are greatly distorted and influenced since an early age by images from the media, advertisement, and the fashion industry that promote an unrealistic and unhealthy ideal of body type and thinness. If we were to estimate the body mass index of the Venus of Willendorf, this sort of Paleolithic Barbie sculpted more than 20,000 years ago, it would be around 40, which by today's standards would be severely obese. But by prehistoric standards, her shape represented beauty and fertility. The Venus painted by Botticelli in 1486 had a BMI of about 26. Early Renaissance standards of beauty were clearly different, and yet for us, a BMI of 26 represents overweight, hardly a standard of perfection. Today we have her. With her 50 kilograms for a height of about 176 centimeters, Barbie has a BMI of around 16. Clinically, she would be considered severely underweight and likely diagnosed with anorexia nervosa. And yet, for most of today's girls, she sets the standard for the ideal body shape, together with real-life actresses, fashion models, and winners of beauty contests. In response to this social pressure, we sometimes respond with extreme and unhealthy measures to achieve our desired body weight, which in some cases become pathological. Anorexia nervosa and bulimia nervosa are considered eating disorders. Eating disorders are not just disordered eating behaviors, they are medical illnesses which require medical attention and treatment. Anorexia nervosa is characterized by a severe restriction of food intake to the point of self-starvation, with life-threatening consequences. It results from a distorted self-perception of body image. Despite looking emaciated and underweight, these patients continue to see themselves as fat, or they recognize they are underweight, but they are obsessed with getting rid of excess fat in specific areas of their body. One of the worst problems with anorexia nervosa is that most patients don't see anything wrong with their eating behavior and they don't think they have a problem, making interventions much more complicated. Some early warning signs that anorexia nervosa may be present or may develop in the near future are eating in a painfully slow way, such as taking an hour to eat a salad or cutting food into tiny pieces to the point of cutting a pea in half, or creating lists of safe and unsafe foods, or complicated, bizarre rules about how foods should be associated, prepared, cooked, or at what times they should be eaten. All attempts at exercising control. Trimming visible fat off of a chicken breast may be a normal response to the frequent messages about the perils of excess fat. But broiling the trimmed chicken breast on a slice of bread and then discarding the bread to eliminate the excess fat that was absorbed from the chicken is clearly a distorted behavior. Although such behaviors do not warrant in themselves a diagnosis of anorexia nervosa, they are definitely warning signs that an eating disorder may be present or may develop in the near future. In women, amenorrhea, which is the cessation of the menstrual cycle as a consequence of starvation, is usually the first landmark sign of anorexia nervosa. Bulimia nervosa is characterized by association of two disordered eating behaviors, binging and purging. In bulimia nervosa patients, compulsive binging episodes trigger guilt, self-contempt, and anxiety, which lead to purging practices to offset the calories introduced during the binge, often through self-induced vomiting. Bulimia nervosa is much more difficult to detect than anorexia nervosa because the body weight of bulimia patients is often normal, if not slightly overweight, and binging and purging behaviors are almost always hidden. Some characteristic detection signs are damaged teeth from the acidity of vomit and damaged knuckles from involuntarily biting them after having induced vomiting. We are still struggling to understand what causes eating disorders. How much of it is genetic, how much is psychological, how much is social, what is the influence of the upbringing, and what triggers the first episode. Everyone can develop an eating disorder, but there are segments of the population that are more at risk. First of all, there is a strong gender bias. About 90% of eating disorders affect women, and young women between 15 and 25 years of age are particularly at risk. Among males, however, eating disorders occur more frequently among athletes, especially in sport that requires weight classes such as boxing or wrestling, but also dancers and swimmers, and in male fashion models. We know that anorexia nervosa patients are very often individuals who have a tendency toward perfectionism, high achievers who set very strict standards for themselves. With regard to the influence of parenting, anorexia nervosa patients often report having parents perceived as overly controlling or overly demanding, setting abnormally high achievement standards, or overly disapproving, often critical of weight and appearance. A history of sexual abuse also increases the risk of developing anorexia nervosa, probably because of the desperate need to feel in control, maybe to offset the shameful feeling and the sense of guilt that their lack of control was the cause of the abuse. The central theme of anorexia nervosa is the need for control. Strictly controlling food intake and therefore one's own body is a way to exercise some control over an existence otherwise perceived as powerless. It's just me versus the food. It's my body and I can do whatever I want with it. I'm in control of at least this one, and I'm going to win. In contrast, bulimia nervosa patients are often very impulsive persons with low self-control as well as low self-esteem and a lack of stable sense of personal identity. They often exhibit stress-eating behaviors, and they often have a history of repeated dieting with repeating weight loss and weight gain cycles. A persistent exaggerated concern or even fear about weight and weight gain are common among both anorexia nervosa and bulimia nervosa patients. Anorexia nervosa and bulimia nervosa are all about struggling with control, which manifests as an excess of control in the case of anorexia nervosa or in a lack thereof in the case of binge eating. But most often, in a struggle between these two extremes, such as the purging behavior of bulimia nervosa, a distressed, guilt-driven, exaggerated attempt at exercising control after having completely lost it during the binge. As we said, eating disorders are pathological conditions that require medical attention, both from a nutritional and a psychological point of view. The strict nutritional part of the treatment is rather simple, but the dietitian must take special care in trying to correct misconceptions about food and nutrition, and to educate about the real physiological effect of semi-starvation, binging and purging. The use of medication is of limited help and quite controversial, while counseling to support the patient understand and address the underlying psychological conflicts, feeling, attitudes, and anxieties is much more important. Cognitive restructuring of food and body image thinking, relaxation training and stress management techniques, self-control and stimulus control training, if triggering factors are identified, have all proved very helpful. But it would be wrong to paint too a rosy picture. While we have cures for the most exotic infectious disease and incredible surgeries for heart conditions, we still do not have a cure for anorexia nervosa. Treatment does not always work, and relapses are frequent, and for this reason, anorexia nervosa patients should never be considered completely cured, but constantly supported and monitored throughout their lives.